So Nick, if you had 5 supplements that a relatively healthy woman you think would need to take, what would be your top 5 supplements?
Well, first off, I think, depending on the age range, but my top 5, because I encounter a lot of women with adrenal fatigue, they're in a very stressful environment. So I would look at what I call adrenal DMG. It's got the ashwagandha, it's got the targeted dimethylglycine for the liver, for energizing echinacea. It's got a variety of herbs, some of which that target RNA, DNA viruses. It's got caprylic acid that targets the candida. So it's really kind of an immune enhancing, an adrenal enhancing,
an immunomodulator type system.
And for the liver. So that would be probably number 1. Number 2, I would say live detox, because it's got the curcumin for the inflammation, it's got asparagus, it's got astragalus, so it's got the things
for the viruses and the telomere promotion.
Yeah, and well, I'll get to the telomere, but it's the apricot. It's got certain things that I hope will help people to modify cellular mutation and the risk of and the development and combat cancer. So I'm looking at that, and of course, then the next I would look at Ester Block, which is, we have a pro version, we have a regular, and then we have a version that helps to also assist with a little bit of a DHT blocker, beta-sitosterol, because the skin is usually where the DHT will show up in those with poor skin conditions, but I don't want to have them take anything other than a whole natural food derivative. So it's got the whole phytochemical
Well, the
nutrients.
supplements that you're talking about, all these different groups of supplements in the product, those are all whole food.
Yes,
Yeah.
yes.
And I think that's important for a clinician to understand the benefit of having whole food supplementation in your vitamins.
Right, and some blend protein, because I mean, we used a rice-based protein because I was kind of concerned about the number of people using what I'll say is, I think, potentially inflammatory type animal-based protein powders. And so I wanted
the whey, the egg.
I wanted to give them a safe, healthy alternative, and then 30 whole organic food nutrients that are gluten-free, soy-free,
dairy-free, GMO, not GMO modified.
Yeah, and we're one of the few powders out there that actually has a certification for organic and GMO-free. So that I felt was another very important core supplement. Stem Cell Strong, because of its medicinal mushrooms, its combination of certain herbs that help to, again, maybe we hope not only calm down inflammation, but if the immune system's too active, it'll calm it down a little bit. If it's underactive, bring it up a little bit.
The amazing thing about the human body is with these supplements that you're talking about, you give the body the ability to use what it needs to store the rest or eliminate the rest. So you're really providing the body a buffet that it can choose from to help bring itself into balance, because this body does want to get into balance. It just usually is being impeded by things that are forcing it off balance. Right. Or it's lacking the things that it needs to bring itself back on balance.
Right. And in women who are struggling with either cellulite, they're overweight, or a little past age 35, maybe they've had hysterectomy or tubal ligation, and then the ovaries not only are not producing enough estrogen, progesterone, they're not producing testosterone. Yeah. The ovaries is the site of testosterone production, right? So I'll give them
one of the sites.
One of the sites, yes. I'll give them a product. Of course, the adrenals can indirectly, right? Yep. I'll give them a product called Testavita Pro, and some women go, well, wait a minute, I don't need testosterone, and I say, well, you want to firm your body up, right?
Well, I think that's very important. That's one of the myths that we need to dispel.
Okay.
Of all the hormones for women, testosterone is far more important than estrogen.
I would agree.
Absolutely, and there's absolutely no question about that. Estrogen plays a critical role for women, so I'm not saying for physicians to disregard the estrogen, but I think there's such little emphasis placed on testosterone that it really needs to be brought more to the forefront. The testosterone being the anabolic, the bone strengthener, the muscle toner, it's one of the hormones that is apoptotic in nature, so that it actually promotes cell death in precancerous cells, rather than the estrogen, which as a promoter it helps continue those cell lines.
Right.
So I think we're going to see something in the next couple of years, because you and I remember 10 years ago with Suzanne Summers coming out with the estrogens and the bioidentical hormones. I think we're going to see a mild revitalization of the bioidentical hormones in women centered around testosterone.
I would agree. And I think the beauty of testosterone is, as you know, some of it will aromatize or convert it to estrogen as it's needed. And with the right herb modification to modify so they don't turn into the harmful form of too much excess unmetabolized estrogens, like the DIM, the Indol-3, the Estroblock thing, and the Live Detox, then they're going to get the right ratios and get the benefit of very, very low dose testosterone. That's the point. It could be a few milligrams, where a man might need, 50, several more milligrams.
There's a number of studies out there that show the use of testosterone in women alleviate the symptoms related to menopause as effectively as estrogen does.
Right. And let's talk about hot flashes, Dr. Paul Savage. What is the indication, or what is the possible solution? Will some of the combinations...
hot flashes like fatigue or hair loss. It's a very nondescript symptom. Yeah. So for a woman to come in to say, I have hot flashes, that doesn't say necessarily a lot for me. It certainly doesn't tell me they have an estrogen deficiency right out of the gate, because I'm looking at things also on what's their nutritional balance again. Are they overweight? What's their sleep cycle like? What's their stressors in their life? Because hot flashes can come from a lack of hormones or too much hormones, lack of nutrients, dysbiosis, illnesses, infections like tuberculosis. I mean, hot flashes can be generated from any of those different things.
Yeah, and then last but not least, I would have the client, the female in this particular case, take what we call Stay Young. Stay Young has the nitric oxide boosters, what we call nitric oxide burst, which is a new breakthrough, an isolate that actually, red spinach, it has removed the phytates. It's got the benefit of the nitric oxide release, and it's very elegant in how it works effectively. Particularly, I can only really tell people to put it in the mouth, but if it kind of slips under the tongue, there's some extra enzymes in there that convert and create more of the nitric oxide release. And so
the amylases, it all plays a big role in that digestive process.
And then I included certain very important phytochemicals that help the telomeres. We believe that we use a 200-to-1 astragalus concentration, which most companies don't look to that importance. I looked at it and I said, well, there's some other extracts that are isolates, and I thought, well, wait a minute, why in primitive time did they say eat that herb, and they would point to the astragalus and say live longer?
You're preaching to the choir on this one, Nick, because one of the things that always irritates me about the supplement companies is now we've isolated this isolate of this, we're just going to take this, and it doesn't make sense, because that's not how the body works. We know that the tocopherols, for example, you need the alpha, the beta, the gammas together, and the closer you can get to a whole food natural tocopherol, the more benefits that it has. And the same thing with astragalus, is you have to give the whole astragalus, and a concentration of 1 to 200 would be a sizable strength.
Right, because we got to figure in primitive times our relatives probably went and foraged and they just like we look out in some of the primitive nations, they would be pulling up tubers and plants and things and eating very large volumes. I mean, it's interesting when you look at Huell Trowell and Dennis Burkett saying they take in primitive societies this very large bowl and eat large quantities to get their nutrients from, because it was so high in fiber. Just to get the calories from it was a little bit of an effort, but they were getting the benefit of that whole food. Now we're going to try and get a vitamin A from one little vitamin A when it's the whole carotenoids, and we're learning the benefit of the whole food. So I think they're coming back around to, and eventually I hope more will recognize that what we did with Delgado Protocol was whole foods nutrition, and looking at the herbs in the most elegant state, at the purest form, and concentrated to the point where in our GMP laboratories,
I agree.
When we label it, we say that's what's in it, that's what it is.
I agree. A high concentration of one isolate, except in a number of limited examples which I can think of, is almost never valuable. I mean,
Well, and there is some challenge to the early science of the telomere test measurements. If there is a plus or minus 25, 30%, but then they're saying the telomeres improved by 25, 30%, which was it? Was it the variance in the test, or was it the improvement due to the product? I would like to hedge the bet and go, I'm going to do a lifestyle approach, because we know lifestyle helps the telomeres, right? Everything we've talked about in this interview.
It's you know, for the doctors who are just starting out, the patients who are just finding doctors themselves, it's the simple stuff is of significant value. And if you're going to spend your time as a physician learning integrative medicine, do as I did, spend time with learning the nutritional part. Out of the nutritional part will become the supplements, as they can aid you in treating certain entities that you're trying to curb. But the learning how to eat well, and it's not the same diet for every patient, as we know.
No.
It is not dependent on the genetics, but the rules are essentially the same.
And I can't tell you how many patients come in and our clients, and they'll say, look, I on this plant-based diet, I'm hungry, I can't get enough protein. And I go, is it protein or is it food density? Look back to our primitive relatives, they ate fairly good volume of food, and maybe you're eating just a little bit too much celery and carrots and squash, which have only 20 calories per cup. You're hungry.
So
you know,
grab your potato, grab your sweet potato, grab your beet, grab your carrot. There's this whole thing with, I don't want to eat carrots, they're too high caloric. We have to get away from the calorie count. We have to look at the density of the food. Now, that's not saying that I don't want them filling up on lettuce and celery. And that you need those phytoestrogens and all those to get in the color. But I don't have a problem with patients are like, potato, that's a starch. That's like, it's a healthy, high density caloric food for you, because what we're doing is we're trying to move you away from this density food that are in Big Macs and processed foods and a lot of the meat products. Although I'm not completely vegetarian, I would say my diet from 20 years ago today is a factor of 10 shift more towards the vegetables and fruits than I've ever been.
Beautiful, beautiful. Well, I'm with Dr. Paul Savage. This is Dr. Nick Delgado. It's been a joy sharing with you real pearls and gems and things that I think you can start applying right away. So subscribe to our YouTube channel. Stay tuned for some of the coming segments. We're excited to share this with you. Thank you, Dr. Savage.
Thanks, Nick.